Hi everyone, if you find this video informative, please provide the feedback in the comments box, click the like icon and subscribe the channel. Appendicitis symptoms, causes, treatment, and prevention. Appendicitis is the inflammation of the appendix, a small, tube-like structure attached to the large intestine. It is a medical emergency that often requires prompt surgery to remove the appendix. Symptoms: abdominal pain begins around the navel and then moves to the lower right abdomen. Pain intensifies over several hours. Loss of appetite, a common early symptom. Nausea and vomiting often accompany the pain. Fever, usually a low-grade fever that may worsen as the illness progresses. Swelling in the abdomen, the area may become swollen and tender. Inability to pass gas may occur due to intestinal blockage. Changes in bowel movements, diarrhea or constipation may be present. Causes: obstruction of the appendix, the most common cause, which can be due to fecal matter, enlarged lymphoid follicles, intestinal worms, trauma, tumors. Infection of viral, bacterial, or fungal infection in the digestive tract can trigger inflammation. Treatment: surgery, appendectomy, the standard treatment for appendicitis. It can be done as open surgery, involves a single, larger incision in the lower right abdomen. Laparoscopic surgery involves several small incisions and the use of a camera to guide the surgery. Antibiotics sometimes used before surgery to treat the infection, or in mild cases to delay surgery. Drainage: if an abscess, collection of pus, forms, it may be drained before an appendectomy is performed. Prevention: dietary choices, eating a high-fiber diet with plenty of fruits and vegetables may help prevent appendicitis. Regular medical checkups, timely consultation with healthcare providers for abdominal pain can prevent complications. Hydration: staying well hydrated supports digestive health. Understanding the symptoms and seeking immediate medical attention if appendicitis is suspected is crucial, as a ruptured appendix can lead to severe complications like peritonitis, infection of the abdominal lining, or sepsis, a life-threatening infection. Thanks for watching this video.